It is exactly 8 o'clock at St. Johns County's 99.5 FM and AM 1170 and streaming this great music all the time online at staugustineradio.com. Hey, every Friday morning, beginning this Friday, actually, we're going to spend some time with Dr. Kalpana DePasquale, and she, of course, was St. Augustine, ear, nose, and throat over on the island. There's another location, too, up in Ponte Vedra we're going to be talking about, and we're going to talk about a variety of healthcare issues that could impact you, a neighbor, or a member of your family. And Dr. DePasquale is a board-certified, you got to pronounce this for me.
Otolaryngologist.
Man, say that 10 times. That is tough,
that's a tongue twister. It's fun.
So what does it mean, though? It means you know all about
the ears, nose, and throat. It's Latin for oto means ear. Larynx means larynx. So it's just otorhinolaryngology is really the complete term, but that really gets to be a little hairy for most people.
She's also a facial plastic surgeon who specializes in head and neck surgery, sinus, dizziness, and thyroid disorders. She's been doing this for quite some time, since 2003. She's also founder of Avanti Medical Spa and Avanti RX, which is a botanical skincare line. And when she's not doing that, I mean, that's a pretty long list. She's a mom.
That's right. I am a mom of 2 teenage boys in my spare time.
That is great. Well, once again, thank you, Dr. DePasquale, for coming in today and joining us on Fridays. We're going to be doing this every Friday morning between 8 and 9. We'll play some music. We'll keep you up to date with weather and traffic as we work our way through the morning drive. But we're going to learn some things about health care and about your health. If you have any questions, too, at any point, and for future shows, you can always just send us a little message on our Facebook page. Go to WSOS Radio, or you can just email me, Kevin at staugustineradio.com, and we will get the questions to Dr. DePasquale. So let's start out first with, overall, Dr. DePasquale, what kind of cases do you see every day? When you're here in St. Augustine and you're working with patients, what are you helping people with?
We really can focus on a wide variety of healthcare concerns for people. That's what I love about my job. I mean, we can see patients with hearing loss, ear infections, sinuses, allergy problems, nasal obstruction, deviated septum, polyps, hoarseness, dizziness, you name it, we do it.
And I guess, this obviously is the start of school. School just started about a week or 10 days ago, as you know, as a mom. I guess there are certain, allergy issues, sinus issues that typically come about with the start of school.
Yes. I mean, we live in Florida, so many of these things will happen all year round. Sometimes they're seasonal, but it's just so important to understand the impact of allergies, chronic sinus disease, and sleep-disordered breathing or sleep apnea on our children and their productivity at school, their sports interactions, their social interactions, and it's really important to understand how these things could be adversely affecting your child if they're present.
Help me understand, as a history major layman here, when somebody has an allergy, what's actually going on inside our body?
Well, what's important to know is allergies is a type of rhinitis. Allergic rhinitis is a type of rhinitis. So when we are exposed to allergens and we inhale them, typically what happens is mucosal congestion occurs. Mucosa is the lining of the inside of the nose, and from there, once that congestion starts, it can lead to nasal obstruction in some more severe cases. But then, as things progress, people can often have congestion around the openings of the sinuses, and that can lead to chronic sinus disease as well.
So why, if I inhale a grass or some sort of a weed or, some sort of other allergen, if you will, I react a certain way to it, but you might inhale the same thing and you don't react?
So it really depends on whether people are allergic to that certain allergen or not. So The best way to determine that is through allergy testing. So it'll tell us if you react adversely to certain pollens, et cetera, et cetera. I think the common assumption is that we live in Florida and everybody has allergies, and that is just not true.
So everyone does not. So there are people. Is it the majority of people do not have allergies, or the majority of people do have allergies?
Actually, 30% of the population suffers from allergic rhinitis, but there are many people that we test and they have non-allergic rhinitis. So they're just different triggers. They have inflammation inside the nose, but from a different reason, not necessarily from pollen, dust mites, cats and dogs, et cetera.
So people really are allergic to cats. It's not that they just don't like them?
Yes,
okay.
They are.
All right.
But some people think they are and they're not. So.
Oh, okay. All right. Well, once again, that's Dr. DePasquale, and she is with St. Augustine Ear, Nose, and Throat. They're located on the island as well as in Ponte Vedra. You can go to saent.net. That's saent.net to learn more about Dr. DePasquale and also to learn more about the practice. We're going to come back and talk about a lot of other things as well as we keep playing music. No major traffic accidents to report today. We're going to get up to 90 degrees with only a 20% chance of rain today. A lot drier than yesterday. Little CCR and John Fogerty here on 99.5 WSOS. Friday morning, it is 9 minutes after 8 o'clock, 78 degrees on our way up to a high of 90 degrees today. No major accidents to report in St. Johns County. It's a clear ride all the way into Jacksonville on 95 this morning in US 1. And Dr. Kalpana DePasquale is with me here live in the studio. And, of course, she is the practice owner, if you will, and lead physician with St. Augustine Ear, Nose, and Throat located over on the island. You can also catch her on television a little later this morning, right?
That's right. I'm glad the ride to Jacksonville isn't too bad because that's where I'm heading right after this.
So if our listeners want to see you on TV, what time should they tune in and on what channel?
It's channel 12 and it's around 11 o'clock that First Coast Living airs.
Okay. And what do they typically do there? Do they ask you all kinds of interesting questions? Are they better at it than we are here?
Well, we only have a short period of time, so I do get asked a lot of interesting questions. We're going to try to cover a little bit of the same topics, but different angles on that show so it doesn't get repetitive. But this way you'll be able to watch me live on the air at around 11 or so.
Well, obviously, Dr. DePasquale does a great job, so tune in at 11 if you can. Tell your friends and neighbors to do so. But right now, she's live with us here in St. Augustine, and this is her home, and we appreciate her taking time out to be with our listeners this morning. So we've been talking a little bit about, because of the start of school, some of the issues that affect ear, nose, and throat that affect our students here in St. Johns County. If they go to school here, a lot of kids may be sitting in classrooms this morning with some problems, with some health challenges that indeed you and your office could help them with.
Absolutely. As parents, we are so focused on getting our children the best education that they possibly can. We want them to get into the right schools, right colleges, have a good life. That's what we want for them. But unfortunately, some of these children have health maladies that affect their ability to function in school. Some of the things that we can help treat are hearing loss. Sometimes that goes undiagnosed for most children. They just can't hear in class, so they can't perform. Also, allergic rhinitis, chronic sinusitis, sleep apnea. These things cause sleep deprivation, and then the child goes to school feeling very tired. They may have morning headaches. They just can't concentrate. Sometimes they're even absent from school because they don't feel well.
Dr. DePasquale, what would be some early signs of potential hearing loss? That's something I think as a parent, you don't think of that. You think that's something that happens to great grandma. That's not something that happens to my 7, 8, 9, 12-year-old or what have you. So what should we be looking out for that might be a potential indicator that our child is dealing with some hearing issues?
One of the hard things with children is I think parents tend to feel that they may not be listening versus that they can't hear.
Wow.
It's hard to say because sometimes they don't always want to listen to their parents. That's the tough part. But bottom line is, if you have to repeat yourself, if the TV's on loud, especially if they're listening to headphones a lot, right, that's a real problem. And if they're listening to iPods and all these things are available these days, if they're listening too loud, they could have hearing loss and you just may not be diagnosed without a hearing test.
So I remember back in the dark ages when I was a kid being tested for hearing loss, and so you put the little headphones on and they send a little faint ping, ping, and then it gets louder and louder. Tell me, is it still done the same way?
It's pretty much still done the same
way.
But it works. It helps diagnose what you can and can't hear. So it's definitely something that needs to be done if your child is suspected of having hearing loss.
We're live this morning, as we will be on Friday mornings, with Dr. DePasquale, and she's with St. Augustine Ear, Nose, and Throat, a longtime member and participant in our community here in St. Johns County. And you can learn more about her and the practice by going to saent.net. That's saent.net. Kind of following up with that, so, we identify that a potential child here in Greater St. Augustine has a hearing loss or has a hearing deficit of some kind. Take us to the next step, Dr. DePasquale. What do you do to help restore that hearing? Or is there, I guess I should also say, is there typically a threat of potentially more hearing loss down the road?
So to answer that question, the reasons for hearing loss are a lot different in children than in adults. Typically in adults, it's sensorineural and nerve hearing loss. In children, we don't find that as commonly, so mostly young children may suffer from something called eustachian tube dysfunction, or they may have ear infections, fluid behind the ear. The treatment really depends on what the cause of the hearing loss is. So if we go with the more common reasons, if it's an ear infection, it could be treated with antibiotics. If it is just fluid that sits behind the eardrum and doesn't resolve resolve, sometimes we do medical treatment first, but if it doesn't resolve, we can put a tube in the ear to remove the fluid and restore proper drainage. And if they do have a nerve hearing loss, we have to undergo a large workup to find out why and then treat appropriately. Sometimes maybe hearing devices are necessary, but that tends to be rare in the pediatric population.
If one of our parents or grandparents listening this morning suspects that maybe a child that's in their family has a hearing loss issue, Dr. DePasquale, do they start out by going to their, the pediatrician or their family doc, or do they call your office directly? How does that work?
So it really depends on your insurance. If you have an insurance that doesn't require a referral, you can actually just call our office directly. You don't have to go, but it depends on what your preference is. Often people think, and sometimes mistakenly, that they definitely need a referral to see a specialist. Again, not always the case. Depends on the insurance, also depends on the specialist. Some require a referral. We don't. If you want to come get something looked at, we're open to that.
All right. Once again, that's Dr. DePasquale with St. Augustine Ear, Nose, and Throat. You can learn more about her, learn more about what the practice does by going to saent.net. That's saent.net. And you can catch Dr. DePasquale live on television today. What channel?
Channel 12 at 11 a.m.
Channel 12 at 11 a.m. We'll be right back. Well, there's Dr. My Eyes, but there could be Dr. My Ears, right? We need to get Jackson Browne to redo that song just for you.
I think we should. Can we ask him?
Yeah, you could. He would do that for you, You're the TV person, not me. They'll do anything for television. Hey, it is 21 minutes now after 8 o'clock. That's Dr. DePasquale. She's joining us here live in the studio. She's going to be doing this every Friday. We appreciate her taking time out of her very busy schedule. And she will be on Channel 12 later this morning, so we encourage you once again to tune in and be a part of that. And that's live television, right, Dr. DePasquale?
Yes, it is.
Man, so that's a little nerve-wracking, right? Because I think radio is pretty easy because we don't have to worry about how we look, We just kind of get on the microphone. But, man, when it's television, got to get the makeup right. The hair's got to be perfect.
Got to get enough sleep so you don't have bags under your eyes.
Right.
So got to do a lot of prep.
How do you feel, honestly, inside of you when the light goes on? And you're on television.
Strangely, the first couple of times, my heart was racing and I was very nervous and I thought something terrible was going to happen. But now that it's been so frequent, believe it or not, I just have a conversation with the hosts and it's over before I know it. And I usually want a little more time.
Yeah, I bet. Well, that's good. That's the way it should be. So your family, you have 2 teenage sons at home. Have they seen Mom on television?
They have. And they don't really think it's a big deal.
Oh, man. They don't think it's a big deal?
Not at all.
So do they encounter, or does your husband, or do your family, like when you're at the Publix at Marabella, do people like kind of, like you're going down the cracker aisle and they kind of look at you twice because they like, it's like that, I've seen her somewhere before, but I don't know where.
Well, I make sure I wear a big hat and big sunglasses so nobody recognizes me.
Well, that's not the point. You're not supposed to be doing that. You're supposed to be like letting everybody know that that's what you're doing.
Well, yeah, I'm joking, of course,
right.
but they don't recognize me. I don't think I'm quite at that level
autographs?
here. No autographs. Nothing like that's happening to me.
See, I would want all that. I would want to be able to stand there in the produce section and say, look, you just can't do any more autographs today. That's all you're getting.
Later I'm going to Publix. I'm just going to stand there and see what happens.
All right. Well, and report back to us. Dr. DePasquale, of course, and she has been doing a lot of work with people that have ear, nose, and throat issues, going back to 2003, right?
Absolutely,
So
yes.
You've been doing this for a long time.
Quite a while, 12 years now.
We've been talking about issues impacting kids this morning, but before we get to that, kind of, let us know a little bit about your background. I mean, where did you grow up? When did you first think that you might want to be a doctor? That kind of stuff.
All right. Well, that's pretty easy. I wanted to be a doctor since I was about 5 years old.
Wow.
My dad was sick one day and he wasn't feeling well. I don't remember what he had. It might have just been a cold for all I know, but he was pretty sick and I didn't like that. I wanted to make sure that he was going to feel better. And I told him, Daddy, one day when I'm older, I'm going to be a doctor and I'm going to make sure that you're okay.
Wow.
So that's where it started.
And it never stopped. So from that point, when you were like in middle school and high school, you probably excelled in biology and chemistry and those kind of classes?
Yes, I loved the sciences and maths, so those were my strong suits. So I felt like I was very suited to become a physician.
So you were she was the girl that, basically like dissected the frog and enjoyed it?
Oh, yeah, that was awesome.
As opposed to the girl that, screamed when the frog was put on the table?
Yes.
That's very interesting.
I was that person.
And then so you went off to college and then you were really like probably laser focused on I will become a medical doctor.
Absolutely. Yes. I went to University of Florida, so I'm a Florida Gator, and, just continued my pre-med studies in Gainesville and, finished up and went off to medical school.
That's Dr. DePasquale. She's live with us this morning here in St. Augustine. And, of course, you can learn more about her by going to the website, saent.net. That stands for, of course, St. Augustine Ear, Nose, and Throat. She's been a part of our community for a long, long time. So when you're in medical school, at some point, I guess you make the decision that, hey, I'd like to specialize in ear, nose, and throat issues.
Yes, that happens in medical school. The funny thing was I went to medical school thinking that I wanted to be an ophthalmologist, and then I wanted to be a cardiothoracic surgeon. And so I went through all these different fields that I wanted to be a part of because I found them all very fascinating.
Right.
But when it came right down to it, I realized that I liked a combination of office and surgery.
Right.
I like the fact that we can treat people medically, and then obviously if medical treatment fails, then we go on to surgery. So I like being able to offer that. I also love ENT because we see so many ranges of patients, men, women, children, adults, elderly. We can treat everybody, and that makes our job a lot more fun.
So for your sons and your husband at home, they get sick. Obviously, mom's a doctor, right?
Yes.
So do they get like immediate, nurse-like care, or are you one of these tough, just tough it out? Come on, it isn't that bad. What kind of approach do you use?
I think I'm a little bit of both. Most of the time, it's tough it out.
I could see that. No, I think that's great. Well, obviously, they have a beautiful family. So speaking of, obviously, you have sons who are in school, who are school age. We've been talking this morning. It's sort of been our theme with kids going back to school and trying to identify ear, nose, and throat issues that would be consistent with, school issues and maybe causing some problems in school. We do have an issue in St. Johns County and throughout America with children who suffer from childhood obesity. And you may not think of it right off the top of your head, but indeed, if a child is obese, it can impact some of those very issues that you specialize in.
Absolutely. So sleep apnea and obesity are often linked. It may not be the only contributing factor, but it's something that we must consider if a child is overweight and they're snoring and they're not really functioning well at school, they're feeling tired all the time, they wake up with headaches, they're looking groggy, they are not interested in social interactions, they're not interested in anything. I think it's something that really needs to be ruled out.
So kids being groggy and sleepy, I mean, a lot of our parents listening or grandparents listening are going to say, well, that's every middle school and high school kid. It's impossible to get them out of bed. Some people may be concerned that our kids have to go to school too early. There's been some issues and studies about that. But how do we know that it's just a typical teenager or preteen not wanting to get up or being groggy in the morning and compared to a real problem?
So again, if it's just being groggy a little bit in the morning and it dissipates throughout the day, I mean, I'm groggy in the morning until I have my coffee, but then I'm fine. So if it's something that's persistent, they're coming home from school looking the same way, they're tired all the time on the weekends, they just don't want to interact, they don't want to participate socially. That's when it gets to that extreme, you got to really consider something like sleep apnea, which can be easily tested for and ruled out.
Okay. Now, if a child, middle school, high school kid, has a sleep apnea issue, are they going to get the machine that grandma has that roars all night long? Is that what's going to is that the deal?
No, not necessarily. So with children, often sleep disordered breathing can be a result of large tonsils and adenoids, allergic rhinitis, chronic sinusitis. So often just addressing some of these issues can cause a significant improvement. The first step, obviously, is to diagnose the problem. And we have sleep studies that they can actually do at home to tell us if they've got sleep apnea. And then from there, once they have sleep apnea, we have to find the reasons from which the sleep apnea comes from.
Okay. I would think, though, gosh, if a kid, especially in middle school, high school, at any age, a student who has sleep apnea, obviously they're not as well rested. There is no way they're going to meet their potential as a student if they have that. And I would think that a lot of kids have gone through their entire academic career with this problem undiagnosed.
Absolutely. Sometimes, they don't really come and tell you. They just think it's the way it's supposed to be. So they don't really know. It's our job to sort of inquire, ask questions, and determine if it's really a problem or not.
Yeah, unlike an adult where we might develop sleep apnea later in life, we know what it was like before when we didn't have it.
Right.
A child may not have that frame of reference.
No, and that's very important. So if you're a small child, you've had allergies all your life, you can't breathe out of your nose, and that's just been your whole life, how would you know that something's wrong?
Right.
So because of that, the problem tends to be underreported, underdiagnosed, and undertreated.
Now, with a child or with anyone for that matter, by the way, we're live on the air with Dr. DePasquale with St. Augustine Ear, Nose, and Throat. So if a child, do they have to not be able to breathe at all through their nose, or are there degrees to which they can breathe through their nose that would be acceptable and not acceptable in terms of helping them sleep and be well rested?
It really doesn't have to be a complete total obstruction to cause a problem for these children. They could have various degrees of problem and it could still result in sleep disordered breathing. So it just depends. You may have one child with a deviated septum that's symptomatic and another one that's not. So it really is patient specific.
Okay. Well, once again, that's Dr. DePasquale. She is live with us this morning, and she'll be joining us on Friday mornings between 8 and 9. If you ever have any questions for her, just do a posting to our Facebook page at WSOS Radio. We posted her appearance this morning on there. Just comment on it. Leave us a question or a comment, and we will certainly pose that to her, and then she'll come back with some answers next week. So anyway, we are live with Dr. DePasquale. It is 30 minutes after 8 o'clock, 8:30 exactly in St. Augustine. We'll be right back. The Rascals and I've been lonely too long. It's not the case for you, Dr. DePasquale, right? Happily married for how many years?
21 years.
Wow, 21 years.
Yes.
And you see Dr. DePasquale and you say, well, that means she got married at 15.
That's exactly
which is
right.
unusual for a medical doctor, but it worked out really well. And what's your husband's name?
My husband's name is Marcus.
Okay, Marcus. So we have to give a shout out to Marcus.
We have
Maybe
to.
we can bring him in here, one day, because I know you're busy and you've got a tough schedule, because it'll be a lot of fun. We'll get the other side of Dr.
Oh,
DePasquale.
God. You may not want to know that side.
Yeah, what it's like at home, what are her hobbies. So that's a good question, because obviously you work very, very hard and you have this skincare line and all these things going on. You got a practice that's thriving here in St. Augustine on the island. You've just opened another location in Ponte Vedra and all that. What do you do for fun? I mean, what is when Dr. DePasquale does not want to practice medicine, what does she do?
Well, I actually have a lot of hobbies, I think, for a doctor.
Okay.
So I think it's important to keep your life balanced. You can't just work and stay focused on that. You got to make time for family, and you got to make time for hobbies. One of my real loves is playing the piano.
Really?
I love classical piano. I have wanted to play since I was a child, and I didn't get piano lessons because my parents thought I would just quit. So they didn't get me piano lessons. And later in life, I was probably in my mid-30s, and my boys were taking piano lessons, and I started taking them as well. So I've been playing for about 10 years, and I absolutely love it.
That's great. I mean, that's really cool. So we should find you on Friday night at Rhett's Piano Bar downtown. I think that'd be really cool.
I think you can find me at home playing on my piano.
I have this. We have to set this up. We're that'd be like a great charity fundraiser. Bonnie Hayflick is here, where Dr. D actually plays piano. We have a big glass jar on the piano, and people donate money, and you take requests.
I think the problem would be that I can't take requests.
Oh,
I'm one of those people that just can't play anything I hear. I have to practice and all that kind of stuff. So I have a couple of pieces that I can play really well, but the request thing, I don't think we'd be making a lot of money.
So I'm assuming, my guess is with Dr. DePasquale, that she decided, all right, I'm going to go ahead and follow through on this piano thing I wanted to do since I've been a kid. And then 9 months later, you're really good at it, right?
No, actually, it took a really long time.
I don't buy that.
No, it really did. I can get my piano teacher here for you. We've made some serious progress. I mean, now I can play for Elise, the long version. I love Beethoven. I play Moonlight Sonata. So there are a couple of pieces that I just really love, mostly classical. And it's really taken a while. It's like learning a new language, learning to read that music and everything. It's just not as easy as I had hoped.
I bet it probably helps you escape a little bit.
It does. It really does.
Good for you. Well, Dr. DePasquale is live with us here, and she's going to join us every Friday morning. We're talking, obviously, about ear, nose, and throat issues. That's her specialty, and she's been doing this for a long, long time, and she has helped countless people here in St. Johns County get to a better place in terms of their health. This morning, we're trying to focus a little bit more, though, on students. Obviously, we're back to school, and we have been talking about how sleep apnea, sleep deprivation, various issues with hearing loss can impact student performance. Some of these issues that you deal with every day, too, can impact the overall student experience, right, in terms of how our students here in St. Johns County enjoy athletics or participating in various other events. And it can take away from the entire academic experience and school experience, correct?
Absolutely. For example, if a child is so tired, maybe they have sports after school, they're exhausted during school, and then they have to go to, football practice, baseball practice, taekwondo, soccer, whatever the case is, they're just way too exhausted. So it affects their performance in that sport, something that should be enjoyable after a long day of school. They're not getting the enjoyment that they should out of it.
In terms of our students, take Nice High School, for example, where your son goes to school. How many kids do you think are there right now that probably have some undiagnosed sleep apnea or other ear, nose, and throat issue that, give us a sense of the scale of the issue.
It's I don't have a study on that, so
Right.
I don't know for sure. But, the bottom line is I see kids on a pretty regular basis that have injuries from sports, have a deviated septum, and they really didn't know they had it. They didn't know that they had a problem breathing through their nose. I just think it's a little more rampant than we might think. We just have to pay attention a little more sometimes.
And I guess, too, if some of our students are trying to combat being overweight or obese, obviously the ability to breathe, is pretty darn key. In other words, it's already going to be a tough challenge to undergo increased exercise. That's just compounded if they have ear, nose, and throat issues, right?
That is so true. And it becomes a vicious cycle. They're trying to exercise so they can get more fit and lose weight, but they're just too tired, and then they don't get a restorative sleep at night when they're, trying to get rested. It's just a vicious cycle.
Right. Well, and of course, it is very important, as you see it as a mom and, of course, a member of our community, to see that these kids are truly well-rounded, right? I mean, it's one thing, obviously, to impact their academics. That's probably one of the most important things, but you see the importance of, our students being able to handle all sorts of different activities and hobbies, right?
Right. And, these days there's a lot of pressure on these children to be well-rounded, do well academically, perform in sports, have a hobby, do community service. I mean, they're just being pulled in so many directions that if they're not getting proper sleep at night, or if they're not feeling as well as they should, it can really impact their ability to accomplish all those things that they're trying to set out to do.
I guess just as a personal note, obviously, most parents out there would be ecstatic if their kid becomes an ear, nose, and throat doctor. I mean, come on. I mean, that's what every grandma wants their grandkid to become, correct? Okay. But back up a little bit. And, I think we can gain some perspective too, because, you probably weren't all academics all the time, right? You had probably a pretty well-rounded teenage years, right? What did you do other than just, have your head in the books?
I actually mostly hung out with my friends. Wasn't as well-rounded as I think my kids are at this point.
Okay.
And definitely that's been my goal throughout my life. I was kind of much more academic growing up. And back then it wasn't so strongly reinforced that we had to be so well-rounded as it is these days. So I think over the years in my lifetime, I've realized that I wanted to become more well-balanced because I needed a little more structure to my life and some more outlets.
Right. But I guess my question would be, do you have to be the absolute most brilliant kid on the block in order to become an ear, nose, and throat doctor? I mean, do you have to be in the IB program at Nice? I mean, what's necessary?
The funny thing is, certain specialties really take the creme de la creme. These surgical subspecialties, honestly, I'm not trying to toot my horn, but they really do kind of want the best and the brightest. They're very competitive. There's only a few spots each year at every residency program, so it is a little more difficult to get into.
Yeah, well, absolutely. And of course, Dr. DePasquale is quite accomplished, and she has an amazing background, but mostly she has helped just countless people here in Greater St. Augustine and St. Johns County. And we encourage you once again to check out the website. And that is saent.net. Obviously, that stands for St. Augustine Ear, Nose, and Throat, saent.net. And of course, she has a large practice location located on the island over at Plantation Island Drive, and also a relatively new location in Ponte Vedra. You'll learn more about both locations by checking out the website. We'll be right back with Dr. DePasquale here on 99.5. It is 17 minutes now before 9 o'clock, 81 degrees in downtown St. Augustine. 5 WSOS. It is just a few minutes now before 9 o'clock, and we're spending time this morning live with Dr. DePasquale from St. Augustine Ear, Nose, and Throat. She's going to join us every Friday between 8 and 9, and we're going to talk about issues impacting your health and perhaps your child's health or someone that you care about. We've been doing that this morning sort of in the spirit of back to school. We've been talking to Dr. DePasquale about some issues that could be impacting St. Johns County students as they go to school. And indeed, there are some issues that you should be mindful of and looking out for that indeed your practice could help with, right, Dr. DePasquale?
Absolutely. As we talked about before, I think there's a couple of huge things that can impact children and their well-being during school. Hearing loss is one of them, allergic rhinitis, chronic sinus disease. Some kids have polyps, deviated nasal septums, sleep apnea. All of these things can impact a child negatively during their school years.
And I guess one of the things parents, grandparents should be looking out for are kids that just seem excessively tired, even more so than the kids that have to stay up late for homework or what have you, right? It's just a sort of a consistent, never-ending tiredness, right?
Exactly. They just seem a little removed from their, and less engaged, I guess is the best word for it. If you have a child that seems not as engaged as they should be in activities they once enjoyed, I think it should really be suspect.
When we come to the issue of sleep apnea with kids that are of student age, we know that as older folks, these are people that, they snore very loudly, or if you're sleeping with a partner or spouse or what have you, and they seem to almost stop breathing, that seems to be an indicator that they would have a sleep apnea issue. How do we look for that? What are the warning signs with our kids? We're looking in at our kids at 2 a.m. and, we check in on them, we see them sleeping. What should we be looking for? Some of the same things or something different?
A lot of the same things. Sometimes there might not be a complete stopping of breathing,
right,
but maybe you'll hear a reduction. You could hear snoring. You can hear some erratic breathing, lots of moving around at night. Maybe the covers are all completely tousled in the morning, indicating a restless night's sleep. So there are some things that you can see if you carefully look.
Okay. All right. And then indeed, some of our students could be having various issues too with their tonsils and adenoids and things like that. Talk to us briefly about what those issues are and how they would impact our students.
So large tonsils and adenoids can contribute to sleep disordered breathing and or sleep apnea. And, many times these children, something as simple as a tonsillectomy and adenoidectomy can solve the problem. But what's important to know is that sometimes there are other issues as well. So if they have other issues like a deviated nasal septum, allergies, etc., those things have to be treated as well.
Okay. And let's talk a little bit about the treatment for those. So say we identify that somebody, a student or a member of our family, has a sleep apnea issue or some other issues with tonsils or sinuses or what have you, and they go and they visit you. How do things progress?
First, we start with a complete history, and a lot of this is just finding out how your child is performing. What are their issues? What are their quality of life issues that are being negatively affected by the problem? So we get into detail with the history, and then after that, we perform a physical exam, obviously examining the ears, the nose, the throat, and seeing what abnormalities that we're finding that can contribute to the complaints at hand. From there, we often will have to order some diagnostic testing, depending on, again, on what the problem is. If it's the hearing problem, we order hearing tests. If it's sleep apnea, we want to order a sleep test. We may want to do an allergy test if the problem is suspected to be allergy. So it really depends what the problem is.
All right. Well, the best way for folks to get started, of course, is to reach out and communicate with your office, right? So if they call your office, they'll start the process.
Absolutely.
Yeah, and obviously, I know there's insurance issues and all that, but probably the best way to tackle all that is to get in touch, once again, with Dr. DePasquale's office. You can call here locally, 904-461-6060. That's 904-461-6060 to just learn more, to schedule an appointment, to just talk with somebody who will interact with you. And you can always go online, too, to saent.net. That's saent.net. And there you'll see all sorts of information about Dr. DePasquale, about the practice, the different things that they can do for you, and there are ways to schedule your initial consultation. And, of course, we want to remind you one more time that you can see Dr. DePasquale live on television, and you'll know it's her because she'll be wearing this really cool blue jacket with lots of zippers on it, right?
Absolutely. I'll let you borrow it one sometime if you'd like.
Yeah, that'd be great. And so they can see you when and where and at what time?
It's going to be on WTLV. Usually it's Channel 12. It'll be around 11 a.m. on First Coast Living.
There you go. Well, have a great time on television, and we'll see you back here on the radio next Friday morning at 8 o'clock.
Sounds great. Thanks for having me.
All right. Thank you, Dr. DePasquale. It's just about 9 o'clock. It's St. Augustine's 99.5.